Hi everyone, welcome to another podcast of Convin Conversations. I'm your host Ashish, CEO of Convin AI, and today we are diving into a topic that's transforming communication in healthcare industry. We are going to talk about how is AI-powered automation enhancing the quality of service and efficiency, and most importantly, patient experience. Today we have Sonal from Medibuddy, India's largest digital healthcare platform. So Medibuddy has revolutionized the entire healthcare industry by offering services like virtual consultation, surgery coordination, diagnostic support, while ensuring seamless and high quality patient communication. It was very difficult earlier. I have my own personal experience of how difficult it was 5 years early, but glad that we have Medibuddy now. So we'll explore how Medibuddy optimized its service quality using AI-driven automation, addressing challenges like manual auditing, data silos, and multiple inconsistent call tracking scenarios. We'll start with that. To introduce Sonal a little bit more, I would love Sonal actually to come in and tell us a little bit about yourself. How have you covered this entire journey? How have you reached here to this point in your journey? And then your role at Medibuddy, so that our listeners can get some relevance, and then we go from there.
Sure. Thanks, Ashish, first of all, for getting me here. And as you know, as you mentioned, my name is Sonal. I take care of corporate growth, corporate sales, and inside sales team here at Medibuddy. I have been working with Medibuddy from last 8 years. And prior to that, I have worked for edtech companies like TutorVista, Edroid, which got acquired by Pearson. So over the last 1.5 decade have been in edtechs and healthtechs industries, which have significantly done well. Really proud about that. In the last 8 years working at Medibuddy, the thought process has been that how do we continue to keep providing more and more services to the users. With the likes of, as you mentioned, online consultation was one of the categories which we started with. Right now, we provide all the health and wellness services which you can possibly imagine in a primary care phase, which can be an online consultation, offline consultation, lab test, which is pathology, radiology, medicines delivered at home, pick up from the store, any kind of a vision or dental services. And especially post-COVID, we have realized that apart from these OPD services, we also have to take care of a lot of disease management programs, chronic disease management program for the consumers with the likes of diabetes care management, or you talk about diabetes management, weight management, hypertension management, and care services such as elderly care, pregnancy care, maternity care, or employee assistance programs, something which we have focused significantly well upon. And as you mentioned, the last piece of the things is surgery care as well, where we basically facilitate end-to-end surgeries for the consumers across India. For the patients, they can come to our platform and we will connect with them. We will have a dedicated care buddy for them to go ahead and provide them a second consultation with a nearby hospital and the nearby doctor, best doctor in that area. And if the doctor suggests surgery, we will help you with the paperwork and we'll take care of your hospitalization, or we'll take care of discharge, and we'll take care of your post-hospitalization recovery as well. So ideally, it's a virtual hospital which we are running at the moment, with the likes of adding technology as the pillar to provide all these services. In a nutshell, you can say it across like what Amazon has done for e-commerce, ideally what we have done for the healthcare, where you have all the vendors, partners like hospitals, service providers, labs, and medicines delivery companies working along with us. And we are able to get them onto one single platform where people can avail all these services which I discussed with you at a click of a button by booking them on our platform. So this is how has been the journey with Medibuddy.
And this was exactly my reaction when I was thinking about it, that this is like literally running a virtual hospital with the kind of services. It is very interesting that how did you really come across building so many services at once? I'm sure it would be extremely hard, right?
Yeah. It all started with the thought process was what WhatsApp was doing across for the users in 2012, 13, 14 is what we got a learning from. That can we have something like a WhatsApp, which we created as a DocSapp as a company by Satish Kannan and N. Bashekar, who are IIT and passed out from Chennai. And they created company known as DocSapp, where you can connect with a doctor over the chat. So it is similar to now you are having or messaging your friends on WhatsApp. But if you have to connect to a doctor, you can connect by DocsApp. In DocsApp, what you provided was that we impaneled a lot of doctors across India in the cities like Bangalore, Mumbai, Delhi, with the thought process that there will be consumers, there will be patients across India who will try to come and take a consultation from these doctors in tier 1 and metro cities, but the travel time will be significantly high for them. So suppose that if you're staying in, let's suppose in Mysore, and you have to consult a doctor in Bangalore, you have to first travel for hours to come across over here, take a consultation, then go back, again have a follow-up consultation, come back and go back, right? So that kind of a inconvenience is something which we saw when somebody really wanted to connect with a specialist doctor in a metro city or a tier 1 cities. This is when I'm talking about Mysore, there will be many more cities which are tier 3 cities and tier 4 cities, right? So the thought process was, how do we get consumers, patients who are looking forward for a relevant doctor being connected through our platform, is how our first service started with the form of similar to WhatsApp. We call it as DocsApp. It is those initial days. Once we got to that learning, one of the things which we realized was that when you take a consultation, you will end up getting prescribed medicines, that is 50% times. So 50 to 55% of the times you will be prescribed with medicines. 25%, 20 to 25% times you will be prescribed with a lab test. So now for us to have a customer coming to our platform, I started to I need to go back and build my network for a lab test as well as medicines. So it started with a thought process of online consultation. We realized that our flywheel will require us to add labs, will require us to add medicines. And in the first 3 to 4 years, we continued to build on these service lines, which basically are the core of providing any services to the users at the moment. If you are able to provide consults, labs and medicines, at least half of the problem statements basically get solved. And then over a period of time, we came up with surgery care and also a lot of chronic disease management programs or any kind of care programs which is there. And again, all these are the combinations of L, which is your labs, C, which is your consults, and medicines. In consults, we started with online consultation, but in the last 3 to 4 years of time, post-pandemic, we understood that, okay, online consultation is not the only thing which people will look forward for. We are looking for a hybrid scenario where you need to have offline consultations as well. And we have started onboarding offline doctors as well. So in labs, you have pathology, radiology, online consultation, offline consultation, medicines delivery from home, pick up from the store, and surgery care. So 4 major services, followed by all the care programs and chronic disease management programs. So ideally, you start small, and over a period of time, you understand what the consumers are looking forward for, and that is how the journey has been.
And this has been amazing detail about this. And how has your role evolved, Sonal? From when you joined Medibuddy to now, what you're doing? I'm sure it has gone through multiple cycles of evolution. If you want to just maybe walk us through that.
Yeah, sure. So I started with, like I mentioned, right? I was in edtech space for 7.5 years, right? And one of the things which we always did was that do a lead generation and then offer these services over the phone call to the users across India. And that's how basically outbound sales team basically function it across, right? Similar to the stuff which we wanted to do at DocsApp. When we were providing online consultations, one of the things which we understood in 2016 was that not a lot of users will come back and take multiple consultations on our platform. So we created a product which is unlimited online consultation throughout the year for the consumer, for their family members, which is spouse, kids, and their parents. So once we started offering this package to the users, we saw that the return rate of these users becomes significantly high at the platform. So previously, if you take a consultation throughout the year, you will end up taking only 1.5 consultations. But if you're subscribed for this gold membership, equivalent to an Amazon Prime, the learning was how do we replicate that? People will end up taking 10 consultations. Means you have a hook factor onto the platform. Then 10 consultations means you will be prescribed 5 times medicines, 2 to 3 times of lab tests. So my primary role initially when I started working at DocSep and Medibuddy. So DocSep and Medibuddy now are same companies. DocSep acquired Medibuddy, and over a period of time, both the companies came and became Medibuddy. So initially, the thought process was that my role was to acquire B2C clients, enrolling them into a subscription of Medibuddy Gold, then offering them medicines, offering them lab test, offering them health checkup for entire 6 months kind of a stuff, right? That you take a health checkup, ideally it's good for you to know what are your parameters, and this can be replicated in 6 months of time. So that was the initial phase. And then when we started surgery care as a service, we added roughly, at the moment, I would say that when I started, it was a 5 members team. Right now, my inside sales team is 250 people. And now the team of surgery care is roughly around 200 people, right? Who basically connect with the users and take care of the understanding that, okay, they need surgery or no, and then help them across. So this is one role. Second role is that because the learning has been from the product, that how do we go ahead and keep improvising and build more products. I also take care of corporate sales as well, where we connect with the HRs of the companies, CHROs, and they spend X amount of money on health and wellness for their employees. So we enroll companies which are there. So it's a different distribution channel. One is B2C sales distribution channel, and in B2B, it's a corporate acquisition channel. So I take care of.
You have seen it all from B2C distribution channel to now looking at B2B corporate distribution channel as well, right?
Yeah.
Very interesting. Because you have seen such a huge spectrum in terms of, even speaking to a single customer versus also looking at how companies are thinking about the healthcare of their employees. I would love to ask you this question about how do you see AI playing a role in improving healthcare interactions, and what has been its impact on the patient experience largely?
Yeah, so Ashish, I'll just tell you our conversations and the reason why I first of all moved from an ed tech towards a health tech startup was that how do we automate a lot of things? That was the thought process behind every single thing, that how do you automate sales as well, right? It's not a matter that if you are unable to automate a lot of things, then the cost of healthcare will also be significantly high, right? And that is something which you would not like to happen in India. Ideally, we would like high quality healthcare at a lowest possible cost, right? And that's the thought process which we build it across. So the thought process was that if I am offering gold to the users, how do I start automating it across? Okay, and that is where our thought process always came across, that continue automating the low hanging fruits. Like if I know certain leads are converting at a 60-70%, then ideally there doesn't have to be a human intervention which is involved over here. I can list it across on the app, and I can get the self enrollments which are coming. So similar was the thought process, and we continued using technology to automate a lot of things. And when AI came into existence, and I think I had a conversation with you guys, the founders were very much keen that how do we start working with AI to get insights of the data, what we are providing, and what do we make the most of it, right? So that was the thought process of bringing AI. And one of the most important part, as I mentioned you, right, when we were offering gold, we never knew what was the best possible pricing for gold. Okay, so I'll just give you an example. When we started working with AI with Convin, in my first report itself, I wanted to see what kind of what's coming from the consumer, the reason for not buying a gold. Okay, and when I talk to my sales team, I will continue hearing XYZ things or the dispositions which they have put it across on the CRM, but there was no clarity that why is consumers not buying gold. But when we started using AI, all the conversations got recorded, transcribed, and when we understood what's the pattern, one of the things which we realized was that the cost of the product itself from the customer's perspective was high. Then I went back to my CEO and told him, boss, I think we should not increase the pricing significantly high. A lot of people said that I'm not interested because I'm not sure whether I will use it across for the entire year, right? Whether I will even take as many consultations to pay you the premium for that. Then I started coaching my sales team that let's start painting the picture to the users that not only you, your spouse, your kids, your parents will be covered, and ideally you will be able to utilize it in multiple departments, which is 20 odd department which used to cater, and that helped us to increase the conversion in both the ways across. So ideally, AI will help you across to get the insights, listening directly from the consumer, which was the most important thing for us. And second is that you can go back, train your team on the things where that sales team is lacking across, and then fundamentally build over and above that. And similarly is what we applied and executed for our labs as well. And similarly is what we are building across on surgery as well, that learn what the customer is saying, try to go ahead and coach the team if there is something which is a difference which the team is not being able to understand the needs of the consumer. And also, if suppose that there are certain leads which I know that it's a 60-70% converge, and then automate it across. And for surgery care, maybe you can go back and schedule the appointments directly with the clients rather than having a human intervention. And suppose that if the leads are converting as bad as a 0.50% conversion, or the ROIs are way too low, then you can even ask these leads not to be dialed as well, right? Because you know that you will not get an ROI from, maybe you can have some kind of automated journeys built across. But the difference between us that if I do this activity with my quality team, ideally you will have 1 or 2% or 3% of maximum audits which you will be able to do. So the data itself is an anecdote data where you may think of taking addition, then you can back off. But if you have 100% of the data says this is the stuff, your additions become a lot more easier to go ahead and take it across. So that's a speed.
No, and this is absolutely fair. I have a quick question here. So one part where you use AI, as far as you have told us, is where you're, let's say, using Convin to analyze the conversation. Is there in the whole journey of the patient, whether it is for selling any subscription, whether it is for patient experience when they call you back, right? Which is maybe on the support and maybe the claim side of it. Are there any other AI enablement products or services that you're using already that we could really look into, like a larger journey perspective?
So I think one of the things which we have been discussing and which we want to do is that at the moment, what happens is that we have a CRM which we work along with, where the customer dispositions happen. What we have done with Convin is that we are auditing and we are seeing that whether these dispositions are correct as per what the customers are saying, right? So some kind of a data, if that can be linked back to the CRM once again, can show me an 100% accuracy, then it becomes a lot more easy that whatever the sales people are inserting is the same thing what the consumers are going ahead and saying. Second thing is that what is very important has been that when the team members get the real-time feedback from AI, the learning becomes significantly high, which results in a higher CSAT. So now you know that not only your 2 to 3% of your calls are getting audited, you will have your 100% of the calls are getting audited. And suppose that you are not providing the right feedback or the service to the consumer, you will get a lower quality score, and the quality team will ideally go back and only listen to these calls where you might have not done a very good job and will pass on the feedback with you again. So rather than a postmortem of 2 to 3% of your leads, what we used to do in the past, which will again not be able to give you the complete picture of what is happening on the calls with the conversations with the people. Now you get a real-time feedback if you have done a great job or if you have not done a great job, and that will also enhance the experience of the end user. Also, second way is that one is you understand that the systems are tracking you and you get a real-time feedback. Second is that if you have to do a callback to the user, if you are inserted some kind of information. So I'll just give you one of the scenarios. In our conversation with a concierge surgery care, ideally 10 to 12 conversations happen with the employee and with the patient, right? Now, all this information needs to be available for the team members. At times, what happens is that when you talk to a consumer for 10 times and you're having conversations of 5 to 7 minutes of time, you may end up missing out on some very critical information.
Yes,
is there,
absolutely.
right?
Yeah.
And now, because you get that information back onto your systems, you can use this information to push that data back to the CRM, and next conversation will always be built on the last conversation which you have done. Ideally, that was not the scenario previously, and you have to again rely back and keep on asking a lot of queries if you have missed out on the stuff. One of the things which I would be interested in that all these conversations which is happening and what we need at Medibuddy can that be pushed across directly to a CRM would be a great next step, because I think that will take time off from the team members as well to push this relevant information, and I will have every single thing which will come from the mouth of the customer.
Absolutely, and we should definitely find a way to power it for you also. Coming back to the use of AI in the whole customer interaction journey and everything, one, definitely it is about automating a lot of queries for the customers. I'm sure you are trying to do that. Second, even if these queries come to humans, which is for, let's say, support or for sales, using something like Convin to analyze the conversation, get more insights out of it, that's there. And then obviously putting all of this data into the CRM to make it work that way. A lot of time when you do such kind of automation, right, you have done a lot of automation, from automating basic queries to even the customer communication that your agents do. Can you analyze it, get more insights? So all of this is a part of automation in general. When people do automation, they're not able to figure out the value of the automation over a larger period of time, right? I would love to understand, how has your business outcome changed as a result of this automation at different stages? How was it when there was no automation versus now that there's so much automation? Has your business outcome improved overall? If yes, what kind of business outcome improvement you're able to see, and how are you also measuring it that way?
So actually, I think one of the things which we were very much particular about was outcome from the AI expenditure which we do, right? Because at the end of the day, if it has an ROI, then ideally it makes sense to keep building on top of it. And fortunately for us, I think one of the things which we always measured was, what is my conversion, right? Whether it's my conversion on gold, whether it's a conversion on labs, medicines, or surgery. Ideally, this is one of the metrics which was there. Now, what we did is that we bifurcated that into two parts. One part was that basically what can be done from a team member end, which he can improve upon to get higher conversion. And second is that what kind of a learnings shall I go back and ask my product team or the technology team or the marketing team to do, right? So these were two basic bifurcations. And when I was started getting the report from Convin in, why are your users not consuming the service or enrolling for the services, we bifurcated in two different ways. Where can team members improve, and what can be the areas of improvement on the product side, which is there. And when it is human intervention, we started coaching people, starting talking about that, which ensured that their skill sets improve on sales or closures or enrollments, and go back to the product team that, okay, this is what the consumers are looking for. This is the pricing which they are looking for. These are not the set of leads to be called. So ideally, you are removing leads which cannot be converting, and you can know what is the best outcome for your lead. So suppose that your lead is converting at a 7%. I exactly know if my sales team is top notch, they do perfectly every single thing, the best case scenario can be 9%. So I will continue focusing upon making them push towards 7.5% as a target, then 8% as a target, because I know this is a doable thing at their end. And we will track them in regards to what is the way, how is their pitching happening? Are they really doing well? Are they asking these certain set of questions for you to get towards that conversion? And the remaining side will basically work along with the product team and the technology team to build on those particular stuff. So we have been able to see the difference where ideally team members have shown improvement to get towards a outcome which is as closer as what best can be provided. And that is the only reason why we have been able to scale the team as well. If you talk about surgery care team, if we plan, we are a technology company, I told you, every single time, if I have to have an additional team member to be opted in, my CEO will have a question to me, ki, why do you need it across, right? And if I am very much thorough about my data, that, okay, my team is doing significantly well. These are certain outcomes which is there. My conversion is almost near to the best possible conversion. For me to have more enrollments, I need to have more people. Then ideally, your chances of scaling becomes very, very powerful, because you exactly know that your team is already at a game A, and there is not a lot of optimizations which are left for you to do over there. And then you can continue adding more team members. And again, they will go back to the same cycle, right? They will have a lower conversion. I exactly know where to coach them. How do you train them? How do you get the insights from Convin? How do you make them better? They can even have their self-learning modules as well, which they can learn along with. And similarly, the cycle continues that you keep adding people and the people continues becoming better. Ideally, your cycles of learning also become significantly lower, because you get a real-time feedback. It's not that after 1 week of time in our traditional old days, you will have a QA who will come in across and will give you a feedback. Today, you are not doing great on the call. Right away, after an hour, somebody will come and will say, "You, ki boss, I think you will have to start looking into the best practices, and this is the way forward." So we have been able to track conversion and enhancing the skill sets of the team members based on the feedback has helped us to improve the conversions as we are potentially looking forward.
Got it. This is very interesting. And has your patient experience also improved after you have put in so much automation, so much tracking at the conversation level? The reason I'm trying to ask is one aspect of using AI in communications is obviously improving your own metrics, tracking, and everything. And the other aspect is the patient, right? If the patient experience improves as a result of all of this, it's a win-win for both sides.
Yeah.
You've
Yeah.
seen this improving?
So I think one of the things which we have done is that we have done sentiment analysis of the consumers, right? For the clients or the patients who come to the platform. One of the things which we were seeing previously was that I think roughly 3 to 5% of the consumers were dissatisfied, ideally more from the perspective of the kind of conversations which they are having with the team members, right? Because somebody might have disrupted the call, somebody might never have called up at the right time, somebody is not understanding what the people are trying to tell them, somebody has been very pushy, so customer will get really annoyed by the end of the conversation for the things which is happening. But that sentiments in regards to a bad experience, we have seen it across as a reduction from the consumer. Second thing is that which has worked significantly well, because now you have a certain set of data which gets fed into your CRM as well as a part of the scripts which you have done, though it is manually at the moment. But your calling to the consumers at the right times is happening at the moment, because if somebody has mentioned you that you have to call tomorrow at 3:30 p.m., ideally you will be able to capture it across and you will call it at that particular time itself, right? Because you have been able to gather that kind of information. So I think follow-ups have been very thorough in the way what we wanted it to happen, because previously we continued having a lot of challenges, but we kept hearing from the customers anecdotally that, okay, the people is not called up, I had requested for a call back tomorrow. So I think that had happened significantly well. Second is that your efficiency in regards to the way the team members are using the time to between dispositions. I think because you have the summary of the conversations, the data fed across onto the consumer platform becomes significantly high. And when the data gets into the CRM, your conversation with the consumers, as I mentioned earlier, gets better, one notch better, which IT says that you do not have to repeat the same information or ask that same information back to the consumer. We can always go back and understand what the consumer has said and just push the things across. So I think being relevant is something which we have been able to see it across. And that's the reason I think the quality scores have improved significantly, which ideally is one of the parameters directly related to the CSAT scores, which we have seen.
And then are you also measuring CSAT now, saying that now that we have put in so much automation, we are training agents, we are tracking what customers are saying, basis that we are trying to put in our strategies or change our strategies? Have you also seen CSAT scores going up generally?
So I think CSAT scores at a calling level, we have not seen it across, because I think I would not ask or would like to check with the client that how was your last conversation has been with Medibuddy. So that is something which we have not tracked at the moment. But overall CSAT scores have improved. But how much can I account that to a Convin or a AI is something which I will have to again figure out. Maybe that how does that happen? But fundamentally, two ways: that follow-ups at the right time, giving them all the relevant informations, and also that every single thing is measured. You're prone to have the right conversation with the people, because you exactly know that, okay, if there is something which get missed out, people will ask you questions on that. So I think that is something which is
got it. And towards the end of this conversation, if there is one thing, Sonal, that you still feel which needs a lot of improvement, and if we do that improvement, you can say that AI will completely change the face of how customer communication happens, at least healthcare. What would that change that you would want to see in next coming years generally?
Yeah, so Ashish, I think the primary thought process will be, how does technology and AI reduce the healthcare cost? That's the first and the foremost thing which we have to build upon. And when you talk about AI, a lot of, as I mentioned, right, if we have 250 team members, it's not a matter of that cost is getting occurred. But
Mm.
if I can treat more patients from those 250 team
Mm.
members, which ideally what I would like to go ahead with. So something like, again, we will go back to the same thing. A
Mm.
lot of times, whatever has to be automated in technology, which we have done it across, but
Mm.
there will be always an AI which can play a game of doing certain things where an human intervention is not needed, like
Mm.
understanding whether the consumer even needs a surgery,
Yeah.
right?
Yeah.
If you know that, next level will be, can you even schedule the appointment with the nearby doctor, with the nearby hospital without a human intervention, which is there.
And
If the lab test or if the surgery has been suggested by the doctor, can you
mm.
again go back and ask that these are the documents which we needed from your end, right? And
Yeah.
then have maybe out of 10 conversation to 12 conversations which are happening with the team members at the moment, if it can reduce towards a 4 5, then ideally is where we would see it. So ideally, if now 250 team members and 200 in surgery care take care of, let's suppose, 2000 surgeries, that is 10 surgeries per team member, what can happen is that you can have 20 surgeries per team member.
Yeah.
And that is the power of AI, which I think can help us across in getting us there, because that's the way we would think that we will be able to reduce the cost and optimize more.
That's a great vision. In fact, I have a specific question related to this, right? To improve the capacity and efficiency and everything that we're talking about. With the new technology coming in, AI phone call has made significant entry, I would say, into our lives, right? People are talking about AI phone calls left, right, and center, and there is a lot of FOMO also, I would say, where people want to experiment with it, try it out. What kind of role do you see AI phone call playing into the healthcare communication space with the patients, obviously? And then I would love to hear your view, what kind of learning you have had in past while working with some of these companies.
Yeah, so I think, Ashish, for me, it's again same thing, that it is very very relevant, very very important, because ideally you will be able to reduce a lot of cost by doing this. And so far, I think we have got to the best and the worst version of the calling itself, though best at this day, but tomorrow it would be the worst. So ideally, you have got to the best and the worst version. One of the things which can happen, and that potentially which I feel will be, that 40 to 50% of the conversations, as I mentioned, can be replaced by an AI call. Because if you talk about the basics to be done, I think that kind of a conversation can happen with AI. Second thing is that not a lot of people, what I would say is that, always want a human intervention to happen as well. Okay, we have been so much attached to our phone calls, we have been so much attached now to your WhatsApp, that not a lot of people even prefer talking to humans. And that is the reality where the trend has been, that why do you have to continue giving that information? So
Yeah.
some kind of a basic information which can be exchanged in the form of technology by AI calls, ideally people are a lot more open to that. And I've seen few of the banking companies, few of the insurance companies who have started to use this product. We are also planning to use it over the next few months of time. And ideally, what we would like to see is that reduction in maybe 50% of my calls to an AI call. And when you have got the basic information, basic details, is when the next conversation of humans can do the things. And that is where ideally we will trend towards. And maybe 100% automation may not happen right away. It may take maybe a decade or so, but the scope is definitely there.
And I certainly agree with that thought process and vision that, yeah, it's going to be more like a balanced approach in terms of how much can AI do and how much can a human do, and which cases apply to both of them. Maybe AI does the more generic work, grunt work, and humans do more specific complex tasks where emotional support is also needed, right? Which maybe AI cannot showcase today at this point in time. So yes, completely aligned with that thought. Sonal, this has been an incredible session. And before we just wrap up, I just have this one last understanding, because I've been able to build something from scratch into like a machine, right? For people who are working in healthcare industry and health tech industry, and they're also trying to optimize for their machine. What is the most important takeaway from Medibuddy's journey that you would like to share with them?
Yeah, I think one of the major factors would be that, first of all, you need to believe that AI will work. Okay. If you don't open your mindset itself of that AI, I think I still keep having a lot of conversations with very, very senior folks. They still think it will take a bit of time, right? And I think I started working with Convin and you guys 2.5 years back, when there was no chat GPT itself, right? And we were thinking about building the things. We were thinking about we should go back and invest in the technology and see what it will unfold for us, right? Fortunately, it worked significantly well for us. So I think one of the things what my learning has been that try it across with few experiments with what you want to go ahead and think of achieving, and then only once you taste the success with a pilot of doing the things, like we started off working with you guys for a very small team of I think 20-25 people itself, right? And then we tasted the success that okay, I am getting what I wanted it to be. And I tell you, right, Ashish, our first conversation was not even to take this data across and feed it across to the product team and to my CEO and to my marketing team that what needs to be done to enhance the product, right? But it came in as a surprise for me, and today that is also as valuable as for me to get the productivity of my team members, to reduce the cost on your operational efficiency, and to get them better at their job role, right? So ideally for me, both the things has worked out significantly well. So start with some kind of a small pilot to see how this will work along. And I think that's the pilot which we want to start off with the AI calling with you guys as well. Start small and then basically see over a period of time how it can be replicated. And when it comes to healthcare, I think definitely a lot more areas can be explored across over here. Any conversations which is related to the consumer, you will be able to really listen back and think about it when you have the deep dive of the data, when you exactly know what are the pain points of your consumer. When we talk about our conversions of X percentage on gold, we didn't even knew which world we were in, right? Then we understood, okay, I think we have to evolve the product. We have to make the things better. So it was not about that I have every single thing and I don't know why the consumers are not looking forward to work with us, right? And the same applies for any kind of a hospitals, any kind of a health tech startups as well, that they can understand what the consumers are saying, what is their problem statement, right? Because healthcare is very, very complicated. And when you talk about the end users, the patients, they ideally connect with multiple people before they even connect with the doctors, right?
Absolutely.
All that information is just going across nowhere. And nobody is here to improve the system or the consumer or the patient experience which comes at hospitals or at virtual digital platforms, right? So if we can hear back from the user, ideally you will be able to create the product and the facilities for the users, and then only you will be able to evolve. Otherwise, traditionally, however we have worked it across, it will continue to run in the same kind of a fashion.
No, absolutely. And I generally share the same thoughts that one, the open mindset is extremely important, where you have to believe that it is inevitable, AI is going to change it over the period in time. And then obviously, experiment with it carefully, because you cannot change the system from 0 to 1 in a day. It will have its own journey over the period in time where you keep on changing few specific elements and then eventually revamp the entire journey for the customers. But yes, 100% line with the thought process of improving the whole patient experience and the customer communication part through AI.
Yeah.
So
I'll just add one more stuff, right? So if you talk about when I started working, I mentioned, right, I started working as for inside sales here at Medibuddy. And I think especially when I started working with Convin, I had so much of time which I can utilize for my other things, because I already know that there is AI which is running on the back end to give me every single data I can possibly imagine for. Okay. Right. And that really changed the things for me as well, because I have more time now. Instead of my 4 to 5 hours just going across on a day in figuring out what is happening on the conversations, doing the post-marketing, working with my team leaders, working with my managers, with my directors, and with my quality team, that I exactly know I have one platform. I can just pull out every single thing and I can live peacefully that, okay, I exactly know what is happening in the team and how I can work the same, pass it across the feedback to the product and to the founder. So I think that worked out significantly well for me, that it reduced the kind of time which I used to spend across to collect all the data
And
across.
free up the mind space also, right? Frees up the mind space. You know that something is running at the back end. It's always giving you the data that you need to make decisions. So it's also free up. No, I appreciate that a lot, Sonal. And thanks for giving us so much time. That's a wrap, I would say, for our Convin Conversations. A huge thank you for making time, coming here and sharing your learnings over the last 8 years, for building something so significant in healthcare industry from scratch, I would say, because this is genuinely transforming how India is looking at healthcare now. And Medibuddy is definitely a significant player. There's no doubt about it. I would love to again take that a moment to thank you and being our guest at Convin Conversations.
Thanks, Ashish. Thanks for getting in. And it was great, really, working with you over the last few years of time. And we will continue building into our journey from here onwards as well.
Absolutely. Absolutely. Thanks. If you have found this discussion insightful, everyone, please subscribe for the next expert conversations on AI-driven business transformation. Until next time, this is Convin Conversations, Ashish signing off. Thank you.